I'm Chuck Black, and this is the Age of Ingenuity, our weekly chronicle of Canada's current innovation economy. And here's what's happening. The future is being built as we speak, although it might not turn out the way we want, especially when it comes to the development of advanced medical diagnosis technologies, an industry currently booming in Canada. We're going to talk about those breakthroughs and their expected effects on the future of healthcare.
I'm Alan Calder, and I don't really care about the specific technologies. In reality, nothing happens without money. We'll be looking at the latest report from the Canadian Venture Capital and Private Equity Association outlining their favorite deals of 2019. Are they just betting on a race that they're all in?
I'm Brian Orlotti, and technology is my friend, especially medical technology, which works like tricorders in classic Star Trek episodes. But I also love the technologies listed below, which allow you, the viewer, to like, subscribe, share, comment, and support this vidcast financially on Patreon and PayPal. So give us a hand. Your actions will feed the algorithms which help to fund and distribute our stories. Speaking of which, here are the stories we're currently tracking. And our first piece comes from the Canadian Venture Capital and Private Equity Association, titled CVCA Announces 2020 Deal of the Year, 2020 Global Dealmaker, Private Capital Regional Impact, and Ted Anderson Community Leadership Recipient Awards. The Canadian Venture Capital and Private Equity Association today announced the winners of the 2020 CVCA Awards, sponsored by Harbour Vest Partners Canada, ahead of the association's annual Invest Canada 20 conference taking place digitally this year.
I think it's worth noting that this group, the CVCA, how do I put this delicately? They are the big swinging dicks of the investment community. They are the institutional investors. They are the high-level venture capital organization. I'm also noting that it's sponsored by Harbour Vest Partners, which is actually a Boston, Massachusetts-based company. It's a fund of fun, but it has a local Canadian office, so they're sponsoring all the Canadian stuff as well.
I can't wait.
Yeah. Well, you got to note that the CVCA was formed in 1974. It calls 2019 its biggest year ever since 2000, which is at the tail end of the dot-com boom. That's the last time there was big money going about. I also think it's worth noting that only half of the big money is Canadian money, and only half of the big money deals were deals made in Canada.
So these guys are at the leading edge of the bust or the tail end of the winning here? Like, are they bleeding though? You know, the bleeding edge or leading edge on that? Like,
well, to be fair, they've been around since 1974. They've gone through a couple of different business cycles. And they have good numbers. I would say that tracking their numbers going back to 1974 is an interesting experience. We seem to crash and burn every 20 years.
Well, that's every 20 years. You're 100% correct. Every single 20 years, you're 100% correct, Chuck. And people are always shocked, right? Oh my God! Again, after 20 years, who could see this coming then? Now, but so the deal of the year then, Brian, was it an American company then who was investing in Canada then?
I believe so, yes.
All right, so just as per usual then, that's how it works. And the Canadian deal of the year goes to an American company investing in some small Canadian company.
Well, and then we wonder why the U.S. can bully us so easily.
They don't need to bully us. We're already bending the knee to them, right? We're saying here's our rewards for us.
Yeah.
I would suggest that everybody in Canada who I've spoken with at organizations like NACO, people involved in government, people involved in the Canadian Venture Capital and Private Equity Association, people I've talked to at OMERS, politicians I've talked to, agree 100% that this is the top end of the ecosystem. C-level deals are made. Deals are made for 10, 50, $100 million at this level, and generally Canadian companies have a great deal of difficulty competing in this space, and their worry is that they've spent the last 15 or 20 years building up their capabilities to the point where they can make comparable deals to some of the Americans, and now they're a little worried. They're afraid that the pandemic depression that we seem to be going through right now. They're afraid that that's going to ruin their deal making capabilities, and a year from now they'll have to start over from scratch again.
Oh, that would be terrible. Just like the rest, just like the low life laws the rest of us have to then.
Well,
the
yeah,
politicians, and you said the politicians, the venture capitalists were making these decisions then, right, Chuck?
No, I didn't say they were making these decisions. I would say they all agree that something should be done. No, nobody really knows what should be done.
What a coincidence then, that they just
Yeah.
don't agree, but they're still somehow agreeing with each other, but it's not the decision they made together.
No, and I would agree 100% that most of these investors, now that the businesses cut back, most of these investors are going back into commodities. They're putting their money into oil. They're putting their money into gold. They're putting their money into Brookfield. I think one of the deals is for Brookfield Asset Management, and it was more of a flow through deal. They're making deals with some of their partners, some of the people who rent office space from them for Brookfield Asset Management. So it's very much of a flow through.
Is that in Canada then, or the States?
Brookfield Asset Management is actually, I'm not positive, but I think it's a Toronto-based firm, but it's got properties all over the world. It's got only a portion of its properties in Canada. As I recall, in one of our previous shows, we talked about how Brookfield was making deals with many of their tenants because of the COVID-19 crisis. They were offering them deals in exchange for equity positions with the company.
What, wasn't that in Ontario at least a law that the companies had to do that who were landlords? I thought that was a law, or at least
no, that's not a law. No, that's not a law. That's something Brookfield rolled out first in Ontario.
I thought so. So am I misleading? Was I wrong thinking that there was a government suggestion about abating rent to tenants then?
There was definitely a government suggestion of abating rent, but there wasn't a position. Some businesses did. Most of the businesses said no, because the government position was predicated upon a 25% rent cut for the tenants, and the government would pay a proportion of the remaining 75%. And the businesses, the landlords, came to the perfectly reasonable conclusion that they will get more of their money back if they kept charging 100% and went to court to get a judgment against the deadbeats.
Or if you can't pay your rent, I'll take my stake in your company the honest way through courts.
Yeah, that's part of it. I guarantee you it is. Brian, what do you think?
I don't know what to think after Al's epic speech.
It was epic, wasn't it?
Wait till you see my manifesto.
And our next piece comes from BetaKit, titled Startup Canada Podcast, Growing from Grassroots with Sonia Setveit. Sometimes when you don't fit the mold, you need to break it. Just ask Sonia Setveit, founder and CEO, Qanic DX Inc. I'm sorry, can we stop here? Why the fuck can't these people who try to come up with these hipster company names use vowels and not just consonants?
It doesn't sound
Is that a rhetorical question or something we can solve?
No,
Rhetorical.
She can solve her problems. Only she can solve her problems. But
like, how do you pronounce this? Canic? Chanik?
All the good names are taken, Chuck.
Mechanic?
I'm just going to go with Canic and be done with it. Sometimes when you don't fit the mold, you need to break it. Just ask Sonia Setveit, founder and CEO of, I think, Qanic DX Inc. Setveit's journey to becoming a femtech founder began with her own health story. When unaddressed hormone issues led to 2 miscarriages, Setveit realized our healthcare system wasn't designed to serve the unique needs of women. The guiding principle, let your pain be your purpose, led her to become a women's health advocate through her blog Hormone Soup. When the blog reached women in 175 countries, she knew she had to do more to help. So she set out to transform women's health.
I think it's worth noting here that the article and the podcast are all about something called personalized medicine. Canada is a hotbed for research into this field. Precision healthcare. It's a medical model that calls for the customization of healthcare with medical decisions, treatment practices and products being tailored to the individual patient. And it's done using a tool that looks like a Star Trek communicator sensor, that little thing that you saw in classic Trek that went wee, 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 and you plug it into your cell phone, which is sort of like the tricorder machine. Existing Danik DX applications, I listened to the podcast, include tracking infertility and menopause, but future applications include diabetes, cancer tracking, and pretty much any disease or virus which causes the body to change in defined and well understood ways. And everything can be done at home. According to the sales literature, no doctor, no appointment, no lab requisitions. And later versions of the applications could potentially also track the medicines and vaccines injected into the body and how they react to the body, and they could even potentially change the reactions of the medicines. So what do you guys think about that?
I guess people's biggest fear about this sort of thing is like track, trace, a database, right?
Yes.
Is that the big Orwellian nightmare that we're all trying to avoid? Or some of us are trying to avoid, rather? Yeah, this seems like it's trying to fit into that bill quite nicely then.
Well, I mean, personalized medicine, I mean, it is still medicine, and so would come under the rubric of PIPEDA and various other pieces of legislation designed to protect the privacy of medical data. So I think there are existing mechanisms to control access.
I agree. There's also mechanisms to prevent access to things like our banking records, and banks seem to drop that all the time. All the tech companies seem to all the time drop our personal data all over the place. It happens all the time. And this is even more offensive than that. Like I'm having I'm on my period. I'm not employable. You know.
Well, I agree, Al. The laws may be in place, but if corporations and governments' IT security is, forgive me, crap, then yeah, that kind of defeats the purpose of having the legislation. I agree.
So if the corporations choose not to follow the law, that's fine then. It's better where we're at then, because we'll say that they should, but we're okay if they don't.
I'm not saying there shouldn't be consequences.
I don't mean you, Brian. I mean, we're okay-ish with. She is saying that though, is what I'm getting at. Like, she's opening up us to that, for women to that, I guess, more specifically.
Well, I would argue that there's a place in medical research to relate your specific development to whatever the keywords of the moment in the news happen to be. So if she talks about COVID-19, really good. If she talks about women's health issues and how important they are, really good. It's more likely to get her the note of the people we talked about in the previous segment, the financiers.
You're right. She sounds very trustworthy, Chuck. I agree.
My issue is that I've read about these things at some point, and my understanding is that medical scientists could potentially, even electronically, change the programming of the medicines after they've been administered in much the same way as things called bioreaders. And bioreaders are a broad category of devices used in the area of bioprocessing and tissue engineering and regenerative medicine in particular to improve, refine, or optimize a biological process. And I'm concerned that these bioreactors at some point could change the way the medicines are intended to react within a body, or change the way the tissues in the body react to the medicine. And I think that's going to flip the concept of informed consent on its head, because we'll give consent once, and then the medicines may change on us.
It's just like Windows, right?
Well, actually, I was using Windows. I was thinking of Windows as an example because, you know, we buy a computer, we take it home. The operating system updates every couple of weeks. I think Windows in particular had this thing called Code Tuesday every month, which changed how a lot of things operated on the machine.
But I did not consent to that. I tried to avoid consenting to that specifically, and despite that, I kept getting new updates, new versions of Windows installed in my system.
Well, Microsoft's counter argument to that is what a lot of companies use, is that, you know, when you buy Windows, you don't own it. You buy a license to use it, and therefore Microsoft has the right to do whatever they want.
On my computer, I agree.
Yes, which is BS. I agree, but that's their philosophy.
Brian, I hate to attack you, and Brian, another thing about white shirts. I was kidding. No, I'm not attacking you, Brian, but just this Microsoft is just, so involved in this shit because of Windows though. When they do these things, updating them automatically, despite my best efforts, updating them to another version, no matter what we do. And it's not, you're right. You're right what they say about it too, right? I did drink the Kool-Aid of Microsoft, you know?
Well, I mean, that's why there's been such a push, especially in the last 5 or 10 years, toward moving towards Linux in corporate and government environments, and even now on the consumer level, because a lot of people are fed up with Microsoft.
What happens if Bill Gates, who used to run Microsoft and now runs the Bill and Melinda Gates Foundation, comes up with a vaccine that he just loans out to us to cure us or take control of our disease, and we don't own the thing that's injected into our systems?
Well, he's a smart businessman though, Chuck. Why would he invest in something that we don't all have to have?
I would say that there's another concern about this, at least from my perspective as well. The technologies taken together for personal medicine are pretty obviously designed to cut down on the medical labor requirements in modern healthcare. It's supposed to lead to substantial overall cost savings, but it also means we're going to talk with less doctors, we're going to talk with less nurses, we're going to be pushed around by less orderlies. What do you guys think about that?
So more computer programs pushing us around instead of doctors.
Yeah, well, they're talking about AI doctors, and they're talking, every other newscast talks about, how AI can spot cancers in X-rays and MRI scans better than humans.
I saw a show from 1980s about dogs that could do that too. We still have cancer.
Well, this is part of what the precision medicine is. Everybody gets their own unique diagnosis. It's done without medical doctors. It's done using a Star Trek tricorder, so you don't need to do anything except wave a salt shaker in front of your body, and
is that what robot proctologists would do? Rub a salt shaker in front of your body, Chuck?
No, in classic Trek, the joke was that most of Dr. McCoy's medical instruments, they were fancy versions of salt shakers.
Al, I had a colonoscopy, and I can honestly and truly say that whether it's a flesh and blood human being or a robot doing it, it's not going to be any less unpleasant.
Well, yeah, at least you didn't fall in love, I hope, but the truth is, I get it. Maybe that's fine. I'd rather have it not done at all. So maybe that's the thing again as well.
I think it's worth noting that, as outlined in the June 10th, 2020 Berkshire Hathaway Business Wire post under the title Global Personalized Medicine, Targeted Therapeutics, and Companion Diagnostics, Market Analysis and Forecast to 2025, this is a huge industry. It's likely to be $85 billion by 2025. It's about 20-odd billion dollar a year industry around the world right now, and it's growing at a compound annual interest rate of over 10% a year. Again, it is where the money is going. All the people we talked about in the previous segment, this is where they're going to put their money if it's not going to go into gold.
Well, I mean, in the United States, there is the argument to be made that deploying this type of technology can help cut the costs of healthcare, which has reached obscene heights in the States as it is. Whether or not it will actually do that is anybody's guess.
No, I agree. I also, referring to some of Al's conspiracy theories, Berkshire Hathaway is owned by Warren Buffett, who hangs around Bill Gates, who once ran Microsoft and currently administers the Bill and Melinda Gates Foundation, which likes this sort of technology.
Maybe it's just a coincidence then.
I also think it's worth noting the concept of targeted therapies didn't start in the area of women's health issues. It was first popularized by the Canadian Cancer Society, and to this day, the Canadian Cancer Society has a webpage online dealing with targeted therapies and their applications to cancer research.
There's also a fair bit of overlap with regenerative medicine, which is the idea of using your own body's cells to create tissues that would be able to be transplanted into you without risk of rejection. So the idea is to customize organs and skin and bone and blood plasma for you. So there is a bit of overlap.
Like
No, I agree 100%. Sorry, Al.
So it's like, so didn't someone grow an ear on a sheep back in the day? You know?
Oh yeah, they could grow bone and skin now too.
Yeah.
And they even made a bladder, and even I think it was even like just a month or two ago, they made a mini liver.
Oh, wow. So they're almost at the point where they can grow a full-size liver, bio-targeted at an individual, and then do a liver transplant.
That's the goal, and also to use grown livers to test drugs, right?
Yeah. For an overview of Canadian precision healthcare efforts, I would suggest checking out the undated Genome Canada post on a precision health strategy for Canada. Think big, start small, learn fast, and a number of various things called report linker overviews of the diagnostic technology industry in 2020, and we'll include those specific links in the show notes below. Anyone here ever watch The Twilight Zone? If this was a Twilight Zone episode and one of us was Rod Serling, he'd likely note that the universal symbol for ideas plus effort multiplied over time is something that we normally refer to as money. Money is something which would certainly appeal to members of the Canadian Venture Capital and Private Equity Association and the CEO of a precision healthcare provider. And we all think we've got the secret to building the strongest sandcastles able to withstand the highest tides. But of course, not everyone succeeds, if only because we live in interesting times. As for the ones that do succeed, we'll keep you updated on the progress.
And those are the stories we're covering this week. As always, the articles we've referenced are listed in the show notes. Keep in touch with us on Facebook, Gab, LinkedIn, Minds, Pinterest, Steemit, and Twitter. Check out other stories we're tracking on our Canadian Innovation News and upcoming events Scoop It feeds. And remember to like, subscribe, share, and comment on our posts. Your actions will feed the algorithms and bots which help to distribute our stories.
If you'd like to promote your event or your activity, or if you think you have insight into Canada's current innovation economy, please send me an email. I'm at chuck.black@protonmail.com.
And we're currently on YouTube, BitChute, and Vimeo, and hope to be on other platforms soon. If you like the content we create, send some money to our Patreon and PayPal accounts. For only $10 a month, you can view the 60 to 80 minutes of raw footage that goes into creating every episode.
And that's all for this week. We'll be back next week with more stories covering our current age of ingenuity.